So we're going to start another episode of Plastic Surgery Uncensored. And this one's very exciting to me because I'm learning so much. I never even heard of Diastasis recti.
Correct.
That sounds like a dinosaur. It sounds like a mean dinosaur, like a raptor.
Like Tyrannosaurus Rex.
Yeah, it sounds So what exactly is it?
So diastasis recti is not a new concept. It's not a new term. It's just more popular now because of a few celebrities like Beyonce who mentioned it. But millions of women have been suffering from diastasis recti, whether they knew it or not. And essentially what it is muscle separation. That's a fancy word of saying muscle separation.
Does it tear? Does the muscle tear?
So essentially what happens is, and it happens pretty much predominantly during pregnancy.
Okay.
And so a woman will get pregnant, and depending on her body, her anatomy, her genetics, and the size of her children, and where the children are located in her abdomen, the abdominal wall is under a lot of pressure, right? So you go from being flat, as in the case of our patient who's online with us today.
And Beyonce.
And then you have this child that starts to push against your abdominal wall, and your body starts to stretch. So everything is stretching, and we're very accustomed to the whole idea of tummy tucks and skin stretch. Right. But we forget about that underneath the skin is an abdominal wall or muscles, the rectus muscles. That's where the recti come in. Recti is plural for two rectus muscles. That's the six pack. And that muscle is also being pushed apart. Now, there's two muscles. They run side by side, and they run up and down, right? We've all seen that in
those charts in science class.
Well, forget that, on Instagram and hot people. And you know that those two muscles are connected or very close together. And what happens is when you get pregnant, those muscles start to pull apart and pull apart and pull apart. And as they start to pull apart, because they're only connected by flimsy tissue. And when they start to pull apart, they're creating a gap between the two muscles. So imagine two gates, two poles, and they start to pull apart. And then what happens is you have your child, you go back to being fit, you lose all your weight, everything goes back except those muscles don't come back together. That separation is kind of permanent. And then you have another child and another child, or you have twins, which is a huge issue today because of infertility. We have tons and tons of twins. Your body can't really accommodate two children as well. And then what's happening now is that
you're having them older.
Right. So what happens is you've had all your kids, you've lost all your weight, you go to the gym 5 days a week, and you have this mommy pooch or a belly pooch. That means when you relax, you don't have any fat. Yes, you have excess skin, but you have this bulge, and the bulge varies from mild to moderate, or in the case of our patient who we're going to talk to, it's very severe. And that has to do with the degree of separation of those muscles. And then, of course, when the muscles separate, what's bulging is all your abdominal contents. Like everything inside that would normally be held in is being pushed out. So that's a diastasis recti. And aside from being a cosmetic nuisance, the main issue is that it creates severe instability in the core. Imagine you have a cylinder and the middle of the cylinder is cracked. So it's not going to hold you as strong. And so what happens is it creates instability, which then creates pain, which creates functional issues. And so a lot of these patients have back pain and can't function, can't exercise, and so on and so forth. So that's diastasis recti.
It sounds like spilling your guts. Literally like that. Your insides are...
It's kind of like that. And we're going ahead and introduce Renee. And Renee had a super severe case. And because she was so fit, you could actually see her intestinal movement through her skin. It was, it was severe. And so that's diastasis recti.
Okay, well, so it's not a dinosaur, but it's ugly and it hurts.
Correct.
Okay, so Renee?
Yes.
Aside from the obvious, cosmetic, you're a fit person and your life is like, okay, I had my kids and I'm fit and I did everything right. But A, my guts are hanging out, and B, it hurts. I mean, this actually hurts.
Right. So you actually can feel when you're pregnant, just that pressure. And again, what Dr. Raban was mentioning, besides the internal pressure, it's like how you carry. I just happen to carry very forward. I probably could have knocked someone down if I turned sideways like a little kid. But yes, you do feel it. And I think the lasting effects of after you're done with your pregnancy and you try to kind of regroup and rehab and whatnot, it's just that stretched fascia stays. And it's because I don't think the tissue has enough elasticity to kind of like bounce back to what it was before. And because all of the contents are pushing out and everything is kind of not in their location where they are anatomically supposed to be.
Uh-huh.
It puts pressure in other areas, or it makes your lower back or your back kind of work a little harder to compensate for the instability that it creates afterwards. So the lower back pain was a huge issue. And
It was throwing you out of balance. Now, how did you know that you even had, I was asking Dr. Raban, like, what are obviously it's visual, lower back. How did you know that this was a difference between like, hey, I just can't lose my baby weight and this is a real thing?
Right. And, I think everybody is so different, but I knew personally through myself, it's just because I knew what I was before. And I think your goal, which can be realistic and to some degree is unrealistic, because the truth is that once you have a baby, it kind of changes your physique, or it should change everything a little bit. But long story short, I just knew besides the bulge, I knew that if I were to do something, like if I were to get out of bed or if I were to sit up, I would actually see like a dome. So, and that was the combination of the fascia that got stretched out with the pressure going forward, and it would just kind of like pop out like a tent. And I started, and I thought, okay, something doesn't seem right. And my OBGYN had mentioned it that, they don't want to concern you while you're pregnant, but he had mentioned it that, you know what, you have a little bit of this, and he kind of just, went like a brief overview, but I didn't really think much of it because you don't hear about it, or I didn't. Now it's more common and people are talking about it more, and there's things like, this segment and things like this where doctors are starting to bring it out.
So question for you, Renee, a couple of things I want to kind of address because I know your story better than anybody. First and foremost, of course, one of the main issues that you have is, of course, you have the back pain. So what did you, let me drive this conversation here, because what did you do to have, exist, your daily life? How did you compensate for the fact that your core muscles were not functioning normally? You wore something. What did you wear?
Yes. Okay. So in order for me, and I have 3 little kids, so I had to be very physical, and I didn't want to be that mom that couldn't do the things that I wanted to do with my kids. So in order to get through my day, I had to wear 2 binders, and each one served a different purpose. So I had more of like a girdle that would kind of push my contents back in a little bit, or at least to a degree where it was comfortable. And then I had a back brace just to give myself a little extra support on my lower back, and so that I wouldn't hopefully damage it further. So that was how, and my job was physical. So I was out on the ice and working with my kids, and I had to show them stuff, and I had to demonstrate, and I couldn't be, just standing back, not representing or showing. So I had to do what I need to do to get through the day and get enough stability to just get through my everyday.
Right. So Renee was a professional figure skater.
Wow.
And, let me give you a little background on Renee. Renee and I met. We recently did a segment for Inside Edition, and she's going to be coming out. And what we tried to do was really highlight, obviously, Renee's scenario is severe, and you usually use severe cases to make examples of things so that you can teach and educate people. And so Renee and I decided together that we would try to, break through this sort of unknown barrier and get some more awareness regarding diastasis. And so she was an ex-figure skater. And so what she's referring to is when she would want to ice skate, which she couldn't barely do, she'd wear these binders. The second thing you were asking her, and I want to address, is how does a patient know that they have diastasis? So we're talking about it. In Renee's case, it's as obvious as day. I mean, there's no question she has something wrong. For other patients, it may be more subtle. Either you have not had as many children, or your body didn't change as much, or et cetera. So the fact that your abdomen bulges doesn't necessarily mean that you have diastasis recti. You could just be overweight.
I was just going to say, you're just fat.
Right. So now all these people are going to listen to this and be like, holy crap, oh my God, I have diastasis recti. My body's not flat like it was before pregnancy. No. So what ends up happening is one of the true tests is that you do a straight leg raise. You lay on the table and you just flat, and you lift your feet off the table, probably about, maybe 6 inches without using your hands. And what you're going to see is that dome or that ridge that Renee was speaking about, which is the internal contents tend to bulge out through the midline where that separation is occurring. And that is one of the main tests. And then your practitioner, your doctor, should be able to feel the edges of the muscle, which normally you wouldn't be able to. So when I do my exam, I'll put my hands down the middle of the abdomen. And as this patient is firing the muscles by lifting their legs up, I can feel the left and the right side of the muscle edge, which in a person who's never had children, there should be no left and right sides. They're touching. There's no space. So that's how you figure it out. Your doctor, your OB, your plastic surgeon should be able to diagnose it. And that's how you know if you have diastasis recti. So the diastasis recti can be in combination with you being overweight or having excess skin or having fat, but it certainly is going to contribute to some of your bulge.
Well, it sounds like a serious medical condition. So is this like a hernia operation? Do you go in and your insurance company says like, oh, you have this thing, we're going to, like, how do you separate it from just, hey, I don't want this bulge anymore, to like, I have a medical condition I need help with?
Yeah. So this actually, you brought up a great point, and I think that's really the whole frustration Renee had, and really why we even embarked on this whole journey, she and I, was diastasis recti today, currently in America, is a non-coverable condition. In other words, unless you have something extremely rare, insurance companies don't see it as a medical necessity. It's considered an aesthetic or cosmetic issue. And unlike a hernia, so let me explain you the difference. So people always get these lingos mixed up. A hernia is a hole in your abdominal wall. So there's a hole, and through that hole, something comes out. So a very common hole is your umbilical hernia, meaning around your belly button, there's a little hole, and some of the contents from inside, usually fat, bulges out. Hernias can be in your groin. They can be from surgeries that you had, etc. Hernias are covered. And if you go to your doctor and you go to a general surgeon, you say, oh my God, I got a hernia. It doesn't matter if it's symptomatic or tiny or whatever. It's a buzzword, and it's probably covered by your insurance. Diastasis recti, I mean, in the case of Renee, was 10 times more severe.
I was just going to say, it sounds like semantics. Is a gap not a hole technically?
No, technically it's not. And so despite the fact that it caused her severe functional abnormality, it was obvious from 100 miles away, it caused her functional deformities, it wasn't covered. And so the issue that we're having today, and why we're having this dialogue, and we need to continue having this dialogue, is it's kind of, I mean, I know this sounds crazy, but it's kind of like a Me Too movement kind of concept.
I was just going to say, this sounds so sexist.
It is kind of sexist, because the reality is that it doesn't, this is not a male issue really. And
I always hear is men having hernias.
If a man has a hernia, it's going to get fixed. If a woman has a hernia, it's going to get it fixed. But if a woman, which I don't know, half of the country is female, and I don't know what percentage, let's say 80% have children. I mean, this is something that's affecting hundreds of millions of women, not thousands.
Okay, so it's hundreds of thousands and potentially millions of women. So you know, my question to you is, back in the day, people would put deviated septum so that they could get a nose job. Like, you can't just put down hernia.
I mean, there are guys, listen, so let me give you a little understanding. Almost everyone, this is where the semantics come in and why this is all screwed up.
Okay.
Almost everyone who has a very severe diastasis recti automatically has an umbilical hernia. So understand the anatomy.
Okay.
When the middle of your belly is separated,
You're hanging out.
right? The belly button, of course, is going to bulge, because the belly button is being held back by those muscles. So one way to get around it, which is silly because we shouldn't have to create funky.
No, I
ways to get
agree
around
with
it.
you.
One way to get around it is to do an umbilical hernia. But the reality is it should be a diastasis recti correction. Renee, let me ask you a question. You're the one who had to go through this hell. So you tell me what your journey was. You tell me what your journey was like when you started to embark on this. So you figured out you had diastasis recti and you wanted to get this thing fixed. So tell us what you had to go through and who you saw and what ended up happening.
Okay. So I think once I figured out kind of what was going on and what was happening inside, I started doing research about doctors and who is going to be my go-to person and who's able to correct this and whatnot. So I started with my OBGYN, who recommended physical therapy. From physical therapy, the physical therapist said, yeah, you have to do something about this because we can't proceed to get to where we want to be. I said, okay, next step was...
Hold on one second. I have to interject because you brought up a great point. I'm sorry to interrupt you. But so what happens often is that you have this diastasis recti, and if it's minor, you can address it. How? You cannot make the diastasis recti grow back together. You can't make it. But what you can do is by strengthening your collateral muscles, by strengthening the other muscles, your obliques and all your muscles in your abdomen, by making them stronger, you will support your abdominal wall and that diastasis will become insignificant. But if you have moderate or severe diastasis, as in the case of Renee, physical therapy is great and all, but it ain't going to make anything better. Go ahead, Renee.
Right. And when a physical therapist, they typically are not, surgery happy. So if there is the physical therapist themselves are telling you that we can't correct this.
Well, surgery's out of their league.
It's just they'll help afterwards, but they're not going to be the first ones to jump to surgery. But when they're saying that, listen, you're at a point or you're in a position where we can't rehab you to the point where you have enough stability to help your back, then at that point I started doing more research. Then the first thing that comes to mind is going to a general surgeon. And you go to your primary care and they said, okay, talk to the general surgeon. I said, okay, let me talk to a general surgeon. So I started there. And then they said, okay, well, we need you to look into something reconstruction because you not only have the diastasis, you have other, you have extra skin issues, and they don't recommend that because it could, I don't know, they mentioned it could collect fluid or whatnot. There were or it could get irritated.
It sounds like a punt, like the general surgeon kind of punted you.
No, so let me interrupt there. So what happens is, it's natural. You have this huge problem in your belly and then you go to your doctor and your doctor scratches their head and says, go see a general surgeon, right? Because general surgeons fix hernias. Plastic surgeons fix hernias too, but it's really not in their wheelhouse because they don't do that anymore. And it's really not something they do as often. So they'll send you to a general surgeon thinking this falls into the wheelhouse of hernias. But in reality, they're going to go about it, if they go about it, the same way they go about hernias by using a ton of mesh or foreign material and things like that. Right, Renee? You heard that mesh thrown around?
Yes, the mesh, the infamous mesh. So yes, that was one of the elements that was recommended to me. Of course, I'm like going, to Dr. Google and I'm thinking, okay, so talk to me about what is this mesh business? Well, it was not something I felt comfortable with.
So why not? Because mesh is usually a foreign material.
For sure.
Right. And so what doctors are doing in general surgery is, like, for example, if you have a hernia and you have a hole, they're using mesh to reinforce or support they're closing up the hole with duct tape. The problem is that in her instance, most surgeons don't feel comfortable correcting the diastasis in an organic way, the way that, for example, we end up doing, which is not using mesh. Because once you have mesh, you have a whole world of issues along with mesh.
Well, it's better to just fix the problem, which is sew it back together.
Well, you would say, but a lot of people. Renee, how many people did you go see?
I mean, that's
gosh. I must have seen between everybody, I must have seen at least like 12 to 15 people.
So she saw 12 to 15 people. And how many of them said, no problem, we're going to just fix your diastasis and bring it together?
Yeah, so that was maybe like 5% of who I.
So 5%.
Even less than that, maybe like
and
one person.
And even the people who she had seen, because her case again was severe, she didn't feel comfortable because they were kind of very whimsical about it, because her case isn't that straightforward. You can see her intestinal movement underneath her fascia because it's that thin. So it's not like you're just going to go in there and just put stitches together.
Can I ask a question? Just this sounds but I got to get to it. Do men ever have this?
So men can have diastasis only when they have gained a tremendous amount of weight and they get a lot of intra-abdominal fat, which then kind of mimics like having been pregnant. But it's incredibly rare.
I was just going to say.
And it's not really a male issue. And even when they lose a ton of weight, I don't see a significant diastasis. It's really about having babies in your abdomen.
So that's why it's probably not as important as it should. Can I say that? Does that make me a bad person?
No, it just makes you the
comedian.
Yeah, the comedian.
Yeah, because I guarantee you that if men were having this pain and their guts were hanging out, it wouldn't be about, is it pretty or not pretty? It'd be like, ow, it hurts. Fix it. Make it right.
Right.
When we come back, I want her to specifically go down her journey because it wasn't easy. So we're just going to bring it right down to, how many people did you have to see? What did you have to tell them? What did they tell you? And how did you finally find Dr. Raban and get it done? When we come back. We're back with Plastic Surgery Uncensored. Dr. Roddy Raban and his patient Renee are going to tell you exactly the steps she took on her journey to get back from diastasis recti.
So Renee lives in Dallas.
Okay.
And Renee went and saw, you went and saw a bunch of people in your local town regarding fixing it, and then ultimately what happened?
Well, Actually, yeah, I ended up not feeling comfortable with the approach. A lot of this, one surgeon just altogether said, fix that and come back to me. I said, okay, great. Well, that's not that was my first moment of, discouragement, but
fix your diastasis and come back to me to fix your diastasis somewhere else and come back to me to get rid of the loose skin, correct?
Exactly. Okay. That was the and so I after that was actually my first consult, and I thought, okay, well, I guess I'm up for a challenge right now, but I'm about to take this challenge and run with it. So after that, I went to another doctor. I mean, basically, to make a long story short, I ended up doing research outside of the state.
Sure. You just look up.
So she was looking for a diastasis.
Different world now.
Well, what happens is that you're looking for a diastasis recti expert.
Yes, right.
You're not looking for a tummy tuck expert. You see,
exactly.
They're not the same thing, but they overlap.
Well, the tummy tucks, in a tummy tuck, correcting diastasis is done. In someone with severe diastasis, the tummy tuck becomes a secondary issue. The issue at hand is, how do I fix my diastasis in a way where I'm functioning again? Well, yeah, so the emphasis has to be on someone who deals with very severe cases of diastasis.
So here's my question, Renee. How long was the journey from soup to nuts, from bulging belly and 2 binders to like now my guts are pushed in and I'm comfortable again?
She's getting on the ice.
Yeah. How long was that journey?
I can't believe it. Oh, wow. So I was diagnosed about 7 years ago with my number 2. And I'm about 8 weeks out. So the research, it took about a year over. I started about a year and a half to almost 2 years trying to kind of understand it. And then I started doing consults. So it was a long journey to get to Dr. Raban. And it was the best decision I ever made.
Yay. So
I think I can't even, describe the life-changing moment that I'm experiencing right now.
Or just being free of the pain and the girdles.
Yes. Yeah, that was it's amazing as humans how we adapt. But the truth is that that's not a lifestyle you want to live when you're young and active and healthy otherwise. So
beautiful.
It's been a game-changing
Well, for
experience.
Our listeners in Dallas, Mazel Tov.
Yeah. So basically, I'd like to just for our listeners kind of give a little bit of a quick summary so we know. So you obviously, like many other women, had several children. You, like many other women, had extra skin and stretch marks and all that. And you, like many other women, decided that you wanted to improve the way that it looked. The thing that made you a little bit more unique is that your diastasis, which was the muscle separation, was quite severe and was really impacting your life. The reason why this story is valuable is because it's bringing much more attention to the diastasis than otherwise would be mentioned because your diastasis was just glaringly obvious. The truth of the matter is there are millions of women who are dealing with underdiagnosed diastasis, and despite their greatest efforts through Pilates, diet, exercise, etc., they're sort of just living this sort of unhappy life because they can't get back to where they want to be. And while they've learned to adapt, they're still quite unhappy. So what we really wanted to discuss and underscore was the importance of knowing that you have diastasis, knowing that there's a treatment for it. That treatment comes through diastasis correction, which is sewing the muscles back together. It's usually done, if done correctly, through an abdominoplasty approach, meaning the incision. I know there's a lot of people out there that are doing sort of limited incision diastasis recti corrections. I am a diastasis recti expert. I do hundreds of these. When you try to fix the diastasis through some cockamamie approach, through inside the abdomen or some minimal invasive or blah, 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 you can't correct it correctly and you end up getting sort of a half-assed job. So in order to fix this, you need to open up the abdomen, look at the muscles, bring them together and double layer it, multiple layers. As in the instance of yours, we did a double layer. So a lot of people just do a whip stitch or something limited. And we did a double layer closure because you need to make sure that the muscles are going to sort of, the fascia is very weak, so it pulls apart a little bit again. Mm-hmm. No mesh was used in your correction, despite the fact that everybody said that you needed mesh. Your umbilical hernia, which was an obvious part of it, was corrected. And in conjunction, you have a beautiful, tight, smooth abdomen, no stretch marks, and you look gorgeous. And more importantly, you're back on the ice and functioning and playing with your kids without the 2 girdles. I think that's really the take-home message. And I just want to end with you and just let you kind of give our listeners sort of your 2 cents about your journey and what you hope to impart to them. Because again, remember, we did this whole thing in order to get the message out?
Right. Well, what I can tell you, mamas, is that don't lose hope. Know that there's options. Know that there are expert doctors in this area like Dr. Vaughn. And do your research. Take the time to educate yourself. Take the time to understand what's going on. And always know that there is an option. And we're working hopefully to advocate for the insurance coverage. That's a big deal.
Yes.
And we're hoping that getting exposure to this issue and having people understand what's really going on from the symptomatic perspective and kind of the aftermath of how it truly can be fixed and you can get your life back. That's the big message. You can be the mom you want to be, you can be the wife you want to be, and take the time to do your research and find the best doctor out there who knows what they're doing.
Beautiful. Well, we appreciate you coming on. I appreciate you being willing to, share your story. And I look forward to seeing your next follow-up.
Yep, that sounds great. Looking forward. Thank you so much for having me.
Thank you, Renee, from all of the women who have listened to your journey. Boy, it was not easy. This concludes another fabulous episode of Plastic Surgery Uncensored with Dr. Roddy Raban.